Today we're going to be talking about the Fraxel, which is one of my favorite devices. I love this device for the body. The reason I love this for the body is because you can really stack the energy really tightly and cover a lot of ground. With something a little bit more aggressive like the CO2, you have to actually disperse the energy so much you don't get much of a result. So what are some of the things you love about it?
Well, I like the combining the Fraxel with other devices, such as the Sublative, because the Sublative is a radio frequency device, which we had done on Dr. Joshin last week, so you can take a look at that video if you would like to. And it goes a little bit deeper, whereas the Fraxel is a little bit more superficial, so for those fine lines and wrinkles, whereas the Sublative is more for like acne scars or the deeper wrinkles.
Yeah, exactly.
Yeah.
So with this device, like Charlene said, we did the Sublative last week to really give a little bit of stimulation to the deeper collagen. And the Fraxel then will go back and it'll improve texture and color and also some of the finer lines and wrinkles. So it's a really great treatment. Now, what areas do you like to use the Fraxel for?
I like to use it on the neck especially. I usually do it a lot on doctor's arms. I guess anywhere. The hands.
The face, the
Yeah, the face.
Yeah.
The hands in combination with some fillers would be wonderful.
Great. So really, if anybody wants to work on their neck, on their chest, on their arms, on their legs, this is my go-to device. What do you think?
Yes.
And our patients are pretty happy with it, aren't they?
Yeah.
The only thing people will talk about with this device in terms of side effects is pain. And the first few times I did this device, I thought it was really painful, but I found it's not so painful. What are some of the tricks you tell people to do in order to make it less painful?
I tell them to numb for at least an hour prior to their appointment, and I also tell them to take an ibuprofen 600 milligrams like 30 minutes to an hour before the appointment, and that really helps.
And I think that's really big. And I've been numbing with a topical numbing right now, so my face is a little bit blotchy, and it makes it a little bit hard to talk. Excuse me, and I guess swallow. But actually, it really does help improve the treatment. And somebody told me yesterday one of the treatments one of the things that they do is to have the patients wiggle their toes when they're doing treatment, because then they focus on something else.
Yes.
So this is a great device, and Charlene's going to be demoing this device for us today, and we'll be talking a little bit more about it as we do the treatment. So we're going to get started with the Fraxel, and Charlene does a pattern on my face. How does it go, Charlene?
I do 8 passes total.
Okay.
But it's
so you
really
do
quick.
2, 2, 2, 2. Is that how you do it? Okay,
perpendicular.
Great. And the first couple you really don't feel much of anything the first couple passes. Excuse me, after the first couple passes, you start to feel, it's sort of like a cat licking your face almost. But if you take the ibuprofen and do the numbing, it's really not that bad.
All right, so are we ready? I'm going to start right here. How do you feel, Tom?
I feel good. It feels a little bit warm.
Just a little bit, though. Not too bad.
And I think if you know that it's really not going to get that bad, I think that also helps. A lot of people, I think, get nervous because they haven't had it done, and so they think it's going to get a lot worse than it actually gets.
The first time is usually when I have to reassure a patient. But that's for any laser, because they don't know,
And the nice thing about this laser is that there's really very little downtime with it. I always tell people it's just a little bit of redness, maybe a little bit of swelling, and that usually dissipates in 3 to 5 days. What do you think?
Yep, and patients actually like that little bit of swelling because it does take away their fine lines and wrinkles. And then it turns a little bit bronze in a few days, and they kind of like how that looks too. So.
Well, the nice thing about this one is there's not a lot of aftercare. What do you tell people to do with this?
I just say use a mild cleanser, make sure you moisturize and sunscreen. That's it.
Mm-hmm. So it's not like the old, more aggressive lasers or chemical peels where you have to stay out of the sun and basically hide, and you have, crusty stuff, and you have to keep your face gooey. It's really sort of the lunchtime peel almost.
Mm-hmm. Yep. Can go a little bit lower here.
Because you can see it doesn't really take very long. How long will the neck take, Charlene, typically?
Honestly, it takes like 10 minutes. It's really, really quick. Sometimes it's the education that takes a long time, explaining to the patient.
And honestly, with this device, I don't think I've ever seen a complication. And some of the other devices, there are minor things that can happen, but with this one, I don't think I've ever seen anything other than swelling. Have you?
No. Nope. How are you doing?
Now, with this device, I recommend 3 to 5 treatments. And I personally like to do touch-ups throughout the year, and that's why I do what we call the laser club at Contour Dermatology. And that is where you get lasers done once a month.